Okay, I think we are ready to get started. Hi, friends. Thank you for joining Tampa General Hospital and More Health's program tonight, focused on stress and anxiety with our youth, especially related to the COVID-19 pandemic. I'm Karen Buckenheimer, the Executive Director of More Health. More Health is a nonprofit organization, and we go into the schools and we teach health and safety lessons throughout Tampa Bay. Teach a lot of lessons. Over the past 30 years, we've taught 4 million students in grades kindergarten through high school. Our lessons are integrated into the classroom curriculum and are matched to the state standards. So we have all kinds of lessons, actually 25. Some of the lessons are focused on nutrition, heart, brain, lung, personal hygiene, all kinds of different lessons that we teach in the schools to help students learn about health and safety. But tonight we're focused on mental health and stress and anxiety. So tonight I'm really excited because we have a very special guest with us tonight, Dr. Nicole Williamson. She is a clinical psychologist at Tampa General Hospital. Pediatrics is her specialty, and she really does specialize in stress and anxiety. Welcome, Dr. Williamson.
Thank you so much, Karen.
So we have a lot of questions from parents, especially during this time. So we have the COVID-19 pandemic. School was canceled after spring break. Students had to stay at home. They had to learn about all of their studies through the computer. Parents had to learn how to become better teachers in addition to the classroom teachers through the internet. Finances have been an issue. They've lost their friends, their socialization. They feel alone. So we've had a lot of stress with kids especially. So tonight we've collected some questions for parents and from parents to you because you're our expert, and we would love to hear how we can deal with stress and anxiety in a more positive way, especially helping our children succeed during this very unusual time. So the first question I have for you is, so what's the bottom line? How can I help my child cope with all the stress that they're feeling with this COVID-19?
Well, to start, thank you so much for having me, Karen. I'm really happy to be a part of this program. I know More Health does so many great things for the community. And like you said, I'm one of the pediatric psychologists over at Tampa General Hospital. So I work with children and adolescents, both inpatient on the pediatrics floor and then outpatient, helping children and adolescents cope both with chronic illnesses, stress, anxiety, depression. So I think that was a great question to start with. So how can we help children cope with just some of the stress that there's so many different things that they're dealing with right now related to coronavirus? So I have a couple of different suggestions of things that parents may want to incorporate. The first of which I think is a really important one is helping children to create a routine. So everything is really out of whack right now. They're not going to school, not in their typical routine in that way. Parents who may be typically working out of the home, maybe working in home. There's not a consistency that usually would be there during the school year. So creating a routine, creating a new routine together with children can be really helpful. Helping them to be able to have some say in maybe what that routine would look like. So getting their opinion of maybe what would be some good activities for them to be doing in the morning, maybe things that would be saved for the afternoon, what time they might like to have lunch, but coming up together kind of through teamwork together, creating a routine so that children have an idea of what to expect throughout the day. Children can get a lot of anxiety when things are completely unexpected and they don't have a sense of what's going to happen next. So by creating that routine with them, it'll help give them that sense of control, both in terms of what they can expect for the day, but also control because they were maybe able to help contribute to certain aspects of what that day would look like. It can be really easy, simple. It doesn't have to be something really creative in terms of artistic, but just something maybe you write out together with them and stick it on the refrigerator. That way everyone's on the same page and everyone has a sense of what the day might look like. As part of that routine, something that can be really beneficial is trying to keep a consistent sleep schedule. Again, it's more difficult when you don't have something you have to wake up for or have to get to, but having a general time in terms of when children are going to be waking up for the day and when a general time for bedtime might be in the evening, and trying to keep that generally consistent can be really helpful. It can allow them to have more restorative sleep as well and ensure that they're getting enough sleep, which we know when children don't get enough sleep, that doesn't help our stress, anxiety, emotions. As part of that routine, it can also be fun to help come up with some fun activities or new things that you want to do together with kids. So maybe some new crafts or incorporating maybe some household projects that you might work on, maybe some activities that usually may not be appealing or top of mind to them, but something that they haven't done in a while, like maybe pulling out some old puzzles or getting out some old painting supplies, things like that.
Oh, what a great suggestion. So good. So I think from what you said at the beginning was to make sure that you have some type of a routine or a plan, or completing a day timer and putting it on the refrigerator would be very helpful, so that the kids know what their day is going to look like. So I think that's great advice. Oh my gosh. And then especially the importance of sleep.
Yeah, absolutely, absolutely. I think some other things that may be helpful to help them cope with stress or just reduce the likelihood of stress is just limiting media exposure. I know that, if we turn on the TV right now, it's pretty much constantly on.
Yes.
And sometimes, we're doing other things as adults and we may not be paying full attention to it, but it may be there in the background. But I think for children, they're very likely to tune into that and really pay attention to it, maybe in a way that's not so helpful. So maybe limiting the amount of television that's on, specifically in regards to news related to coronavirus.
Okay, such great advice. And from more health standpoint, nutrition and physical activity, we always highly recommend that in all of our lessons, as far as a way to decrease stress, but to make sure that they're getting some balanced meals, low in sugar, and also, of course, to get outside and get that fresh air is so important to help deal with that stress.
Absolutely. Yeah, and I think that can help with our own stress kind of as parents too, getting outside, getting some exercise, moving. I think we can kind of, especially since we're working from home, lose track of time sometimes, and really not have that physical movement that would be there when we have to get out of the house to get to different places, or when our kids are walking from class to class. So getting that exercise in is a great point.
Right. Okay. Fantastic. Now, what do you think about I don't know, just some basic things around the house that's been happening with the COVID-19? Is that, for example, all the hand washing, all the, social distancing, and gosh, I got to wear a mask. So let's just say, like, one of the parents posed a question saying, my kid is sick and tired of everything. They don't want to wear the mask. They don't want to social distance. They're over it. They're ready to go out. They're ready to be with their friends. They're not following the rules, and we are at each other's throats. What do you recommend for parents? It's been a long time since this has all been going on, and some kiddos are ready to say, I'm over this.
Yeah, absolutely. So I think some maybe communication tips that can be helpful when talking about this with kids, and understandably that there is frustration there. Just helping them trying to cope with that disappointment. So trying to kind of listen when they are expressing those disappointments, frustrations, angers, validating it, meaning saying that you acknowledge it, not necessarily that you agree with what they're saying, but you acknowledge it and you understand that it is really challenging and frustrating. Not necessarily jumping into problem solving or explaining, but just giving them an opportunity to really say some of those frustrations. I think something that can be really helpful, since many people are having, family dinners together, there's not necessarily all the activities that would be there that might pull us apart, utilizing that as a chance to really talk about maybe something that went well that day and something that didn't go so well that day. I think that can be helpful because it can allow kind of an ongoing forum for some of those thoughts, worries, frustrations that our kids might be having, instead of having it just kind of build up and explode.
Right.
Yeah, I think. Oh, sorry. Go ahead.
I'm sorry. They're lonely.
Right.
The kids are really missing their friends, and they are missing just hanging out. And so what suggestions do you have to help students feel connected to their friends? Because that's a real void for them.
It is, absolutely. I mean, I think a lot of kids are taking advantage of calling friends, texting friends, FaceTiming friends. Just from the children and young adults that I work with, it seems like a lot of kids really are taking advantage of that. And I think us as parents maybe recognizing that our children may be on their phones or maybe on electronics a little bit more often now than they would be otherwise, because they're really using it as a venue to be able to communicate with their friends in a way that they can't in real time, where they might have done otherwise. I think along those same lines, some young adults are really utilizing video games to be able to do that. Lots of communication there with maybe classmates or friends, again, that they can't see in person, but that they can play a game with, talk to while they're doing it. So, so taking that into account, that our children may be using kind of a different way to communicate with friends, and really that's a beneficial thing for them. It's a good thing. It's really important for them to stay connected with friends. Other things that we can encourage them to do just to feel connected, making cards, whether it's for family that they might usually be able to see on the weekends that they're not seeing, or maybe writing an email to grandma who, again, maybe they're not getting to see or communicate with as often as they would otherwise. Another way for them to just feel connected maybe to the broader community is thinking about maybe incorporating some acts of service, something positive that they can do for maybe a neighbor, maybe helping a neighbor mow their lawn, or writing a card for a neighbor, putting it in their mailbox, just feeling connected not only to those immediate friends and family, but maybe to our broader community, our neighborhood. All of that can really be beneficial with helping with kind of stress, anxiety.
Those are all great suggestions. And then finally, in regards to just being around at home, parents are feeling very stressed, especially regarding their finances.
Yeah.
And so is this something that parents should have a conversation with their children, or is that something that we should kind of keep private?
I would say the answer to that is somewhat variable based on the age of the child, and maybe different depending on the child's developmental level. But I think, with all households, we can always frame the benefit of saving money, conserving our money, saving our money for other purchases down the road, and kind of framing it in that way. I think with elementary age children, if we've had a setback in our income, maybe talking with them about something they can do to help give them control in that situation. So maybe what's something that they would usually ask for when we go to the grocery store, like a snack or a treat, what's something that we can do without? And that's a way that they can contribute to the household, not allowing them to feel anxious that we don't have money and there's nothing they can do about it, but rather reframing it as, we can all take part in saving the money that we do have. This is a sacrifice you can make. This is a sacrifice mom and dad are making. We can all save our money in a more effective way. Same thing, I think as children get older, they might have other ideas about it. Middle schoolers, we can help have them in charge of maybe taking a shorter shower, or in charge of maybe making sure all the lights are turned off when we're not using it. Again, helping them to feel some sorts of sense of control and kind of contribution to the family, while understanding, okay, not at a worrisome level, not that we're giving lots and lots of information about, specific reductions in finances, but just overall that we're being more careful with our money.
Okay, fantastic. Those are great. Just really to engage them at the appropriate level that they are, but to help them have some control with it, because they're probably feeling very out of control. Okay, great suggestions. So let's move a little bit more into anxiety. So tell me, what's the difference between stress and anxiety? And I know something that what would be your suggestions on how we can decrease anxiety for our children, or those anxious feelings?
Yeah, absolutely. So, kind of first, just the thought, is stress and anxiety something that everyone goes through, or when do I need to be a little bit more concerned about my child? So first, kind of course, all of us do have stress, meaning there's things that we go through that are challenging, things that allow us to focus on them more. Anxiety, where it's things that we might think about over and over. All of us experience that to an extent, that, fight or flight response. But when we can't get it out of our minds, when we keep thinking about things over and over and over, or maybe worrying about things over and over and over, that's when it kind of more starts to escalate to that level of anxiety, where we might be more concerned about it. When it really isn't protecting the child anymore, instead of when it's kind of getting in their way of their ability to function, their ability to do what they want to do, what they should be able to do. So for example, if they're so worried about something that they can't even begin to tackle it. They're so worried about an assignment, they can't even think about opening the book because it's just paralyzing anxiety. So it's chronic as well. So it's not just a response to one specific situation or one kind of off afternoon, but again, when it's a more kind of general way that someone's responding, that's when we might think about it as a little bit more challenging. more kind of at that anxiety level. And some strategies that may be helpful when thinking about some anxiety related to the coronavirus. Allowing children to ask questions. So that's one that I think is really important. I think not necessarily that we have to be bringing up potential questions that they have all the time, but giving them that forum to be able to ask questions and just being open and honest with the answers that we have. And sometimes our answer might be, I don't know. So they might ask something and there's not a definitive yes or no answer, but saying I don't know and helping them to be able to tolerate that uncertainty that all answers aren't always crystal clear. When we help them be able to tolerate that uncertainty, we can help them, build resiliency and be able to cope with uncertainty, which is something that all children need to learn to be able to cope with. Yeah.
So when do we, as a parent, how do I know when it's kind of time for me to reach out and find a psychologist or counselor or someone to really help, that I'm very concerned about my child? What would be maybe some of those warning signs?
Sure. Yeah, absolutely. So there's a number of different signs that we might kind of keep our eye out for. So some more emotional signs could be irritability, getting really angry, frustrated easily. When we see maybe changes in difficulties in concentration, focus, difficulty with our children being able to relax. So seeming like they're always on edge, just their brains are always going. Always ongoing worries, just having trouble shutting off their brain. Maybe being a little bit more clingy with their parents or significantly more clingy, having a lot of difficulty separating. Sometimes in younger kids, kind of anxiety can manifest as having a lot of meltdowns or tantrums, just being unable to control or regulate their emotions. We might see some social changes, so maybe isolating themselves, withdrawing, not participating or spending time with friends, not interested in talking to friends, avoiding things. We also might see physical changes. So these can be somewhat common and maybe not, we don't always necessarily associate it with anxiety, but I think can be good for us to keep our eyes open to the fact that anxiety could manifest more as, stomach aches or fatigues, headaches, just kind of unexplained aches and pains or difficulties in sleep. So certainly a number of different signs. And of course, just one specific sign isn't enough to be concerned. But when we see kind of a number of these different signs manifesting, that might be a pattern that we want to just kind of cue into, and it may be a sign that we want to seek additional services.
Okay, that's great advice. So we have a few minutes, and I really wanted to hear some noise. I hope that's not me, but I wanted to just make sure that we tell everyone who's on tonight about some fantastic resources. You put together a long list of resources for different age groups, and they're great apps and things like that for kids to use to help decrease their stress levels and hopefully be able to calm and relax a little bit in this kind of stressful environment. And then a very special lady at Tampa General, Danielle DeCosmo, she is in the integrative arts and medicine area of Tampa General, and she is a very, very talented lady, songwriter and singer. And she has a couple of videos that one is like the beginning of it's blowing bubbles and trying to breathe and calm down. And then she has some beautiful songs that she has written and also sung, and some Disney songs. So we are sending everyone tonight that's on a great email that has the list of all the resources and also those two videos that you can link to on YouTube. And Danielle is just amazing. And then we also have the More Health website, which is www.morehealthinc.org. And we have a virtual health library or center that all parents and kids can go to. We have a student section and also a parent section for resources and information on how to really deal with stress, especially during this time, and hopefully with summer upon us, that things will calm down and we'll be able to get back into the school routine next fall. But I really wanted to thank you, Dr. Williamson, and let you close tonight. I really wanted to thank Tampa General for hosting this event. They are Morehealth's founding partner, and we're so proud and honored to be part of the Tampa General family. And Dr. Williamson, thank you very, very much for being here tonight. You're just awesome. You're so filled with information and have such great expertise. And for you, I'd like you to just close the evening tonight and share with us your final thoughts. And thank you again.
Okay. Well, thank you, Karen, again. Yeah, thank you for allowing me to be a part of the program. I mean, I think overall, just really closing thoughts are that I think, that we as parents really have the opportunity to kind of set the tone for what this challenging time looks like for our children. And I think that we have the capacity to do this. It's very stressful. It's important for us to take care of ourselves, to take time out, for us to be able to recharge so that we can be there to support our children. But I think that, the fact that all of you guys already tuned in, it's clear that you're, already thinking about how to do that in the best way. And I'm glad I could be able to be a small part of that. So thank you very much.
Thank you very, very much. I hope everyone has a fantastic summer, and certainly reach out to Tampa General, to Dr. Williamson, or to Morehealth if you have further questions. Thank you all. Have a wonderful evening. Bye-bye.